We were chatting, having fun. There was definitely a spark.
When she thought you were gay. What is a culotte anyway?
Pants that hang like a skirt.
You think he's okay?
It's an ear test. Pretty sure he'll live.
At least we know his ears are okay.
Did we just glaze over the fact that the patient was seizing on the borderline of a stroke and Foreman says, at least we know his ears are okay. At least we know his ears are okay. If that isn't leverage for a higher salary and a double promotion to King of Communication, then I don't know what is. Very excited to be reacting to House MD Season 6, Episode 10, The Down Low. On this channel, we are reacting to all 177 House episodes, and this will be episode 122. Let's see if I can get the diagnosis before House does as a doctor working in London.
I'll give you 30.
What? I thought you were joking.
I thought we had an understanding. Whoa.
Tommy, just relax, buddy.
I nailed myself in the foot. I don't think he's hit. Mickey, wake up!
I'm ordering a head CT.
No, I don't have a headache. I'm not dizzy.
Those scrapes on your hands means you didn't try to break your fall. Powder burn on your jacket sleeve means someone shot a gun. If you don't get this checked out, it'll happen again. Cool. Loud noise induced vertigo. CT was clean, no internal bleeding, no edema.
All the rest of these pages are blank.
He's a drug dealer.
He actually said he was a drug dealer?
Not out loud, but he was wearing a solid gold Patek Philippe.
So I'm thinking acoustic neuroma.
Acoustic neuroma fits. So does lidocaine toxicity, or benzocaine. Depends what he's cutting the coke with. Test his ears, I'm gonna go test his cocaine.
If you have any more questions about the neighborhood, I'm your girl.
Maybe we could get dinner sometime.
Whoa, wait a minute. Noise-induced vertigo, but the man falls down as a result of loud noise? You know, when I used to make these reactions, I would do it straight after the opening scene, but now I wait until their first debrief for this exact reason. You see, vertigo is a pretty severe type of dizziness where the room is spinning. Sometimes this can be quite hard to describe in detail, so the best way I let patients volunteer the symptom is by asking if stationary objects look like they're moving. If the answer is yes, then that is true vertigo. But what we saw most definitely wasn't that. We saw him actually passing out. Let's give some goodwill though and assume it actually is vertigo. Then what could this be? Well, there is a strong connection here because the ear and nerves from it actually mediates both the perception of hearing and balance. The main balance center is the inner ear that contains something called the semicircular canals. There are 3 of them on each side that are oriented in different planes. The fluid in them sloshes in different directions when you turn your head, which sends signals to the hairs inside where your head actually is in space. So how do they go wrong? Well, when the signals fired from that area are incorrect, it can keep telling your brain that your head is spinning when it actually isn't. The nerve that conveys the information from there, known as the vestibulocochlear nerve, also conveys sound information. So if there were an abnormality there, like a small tumor, as Foreman is suggesting, then that could cause his symptoms. But what else could it be? Well, there's a very interesting diagnosis called a perilymph fistula that can create an abnormal connection between the middle and inner ear. You could also get a migraine specifically related to that inner ear called a vestibular migraine that's triggered by loud noise, but then it wouldn't have resolved straight away like it did. Definitely still wide open here. I'd want to have an MRI scan for sure and some bloods. Also interesting to see Wilson's trying to get back out into the dating world. Clearly his status seems to have gone from amber to green light. Let's see what happens.
Sure, if you promise to bring that good-looking guy with the cane.
You mean House?
Your boyfriend's name is House?
We're not gay.
Seriously?
Sensors measure electronic activity to your auditory nerve. 13's middle name is Beauregard?
House is clearly screwing with us. There's no way she makes that much money.
I make that much money. Apparently you don't.
We're in textiles.
I need the drugs! Works for Jack Bauer. Let's talk about textiles. What's your major product? Is it H? And by that I mean hosiery.
Culottes.
Does your friend cut the fabric?
No, no one touches the culottes.
Can I talk to you for a second?
I'm interrogating a suspect.
Everyone in our building thinks we're gay.
We'll figure out we're straight eventually.
Eventually is not when I want to go out with the cute girl in 3B. We were chatting, having fun. There was definitely a spark.
When she thought you were gay. What is a culotte anyway?
Pants that hang like a skirt.
You think he's okay?
It's an ear test. Pretty sure he'll live.
At least we know his ears are okay.
He got worse here at the hospital, means thug life probably isn't what's making him sick. Carotid stenosis.
Get an ultrasound of his carotids.
I want a raise. I know that you're paying me less than everyone else on the team.
Salary isn't about fairness. It's It's about what you can leverage in a negotiation, which isn't much without a competing offer on the table.
Okay, Foreman's salary aside, did we just glaze over the fact that the patient was seizing on the borderline of a stroke, and Foreman says, at least we know his ears are okay. At least we know his ears are okay. If that isn't leverage for a higher salary and a double promotion to King of Communication, then I don't know what is. So what new clues do we have about our culotte salesman? He had critically high blood pressure, he's still getting worse while on hospital grounds, his nerve tests were normal and so was his urine. Put that with noise-induced vertigo, and what could this be? The team are wondering if the brain just looks alright on imaging because it's being affected by something outside the cranium. That's why 13 suggested narrowing of the carotid arteries, which are like the 2-lane highway up cerebral city. If the highway is chock-a-block with traffic, then the city starves of its precious deliveries of delicious oxygen as it's redirected away. That could explain the high blood pressures as the body reflexively increases it to try and squeeze the deliveries through the tight gaps, like sending an oxygenated motorcycle through there. Please don't actually build an oxygenated motorcycle. My metaphors shouldn't have that kind of explosive impact. So what else could have caused this? Well, sudden high blood pressure could be as a result of massive amounts of stress hormone leaking into his blood circulation. As a guy who is happy to face down a gun barrel, something tells me a hearing test won't quite cut it. I've got a theory. He has a tumor in his adrenal gland that's causing massive amounts of adrenaline to be released in bursts. This cranks up his blood pressure and could potentially cause noise-induced vertigo through autonomic stimulation. Alright, I'm going to go for pheochromocytoma as my first diagnostic guess, which is what I've described.
Ultrasound showed no narrowing or obstruction in the patient's carotid. You bugged his room?
He's got toxins stored in his fat cells. Every calorie he burns makes him sicker.
I got things I gotta take care of.
You're worried about all the poor school children going without their drugs?
This is ridiculous.
He's sitting in a lab all day.
In the lab, there is significantly less chance of getting killed. Play with the watch, by the way.
Borrowed it from a friend. Shut up.
3B. You're Nora, right? I hear you thought that Wilson and I like to polish each other's swords. We're both straight. That is beautiful. Nice shoes, by the way.
His friend brought him in 15 minutes ago. Temps 105, pulse is weak and thready.
And if it is an infection, symptoms suggest it's moved to his brain.
To a lumbar puncture.
Next time you're tailing someone, take 2 cars.
Do you have any junkies coming to the ER every week with their brains melting?
I bet there's more drunks with their livers giving out.
A drug dealer turning the cops on a bunch of doctors trying to save his life. I love how House plays with the idea of the law and the right thing, not necessarily being aligned. That being said, what if 13 running the red light ended up killing a child to try and save a drug dealer? Would it still be the right thing? I guess nobody's arguing that doctors in the real world should let patients go so that they can go find their stash though, so not much of an ethical dilemma in that one, but still great TV. What's even greater though is we have a new clue. Fever. The team think that makes an infection more likely and so are sticking a needle in his spine without doing a repeat head scan first, which would definitely be necessary to make sure his cerebral situation hasn't changed. It's a good idea to check for encephalitis here, which this could be, but that diagnosis isn't so spicy. In all fairness, my first diagnostic guess, pheochromocytoma, could also cause fever as it is a known cause of fever of unknown origin. But what else could it be? Well, thyroid storm could potentially be doing it. Thyroid hormone regulates our cell speed throughout our whole body, and so if you had a tumor that was causing overproduction of the hormone, that stimulates the thyroid gland, and then that could, in theory, cause all of his symptoms. There's also some evidence that loud noise can increase thyroid hormone release, but that's more over long-term periods. So where could this thyroid thrilling hormone be released from? The testicles. Oh, it could be one that would show up a pregnancy test as positive called HCG. You see, cells, like doctors, all have a degree of specialization. Testicular cells are fairly specialized. They serve a very specific function, just like a brain surgeon that asks you to go see your family medicine doctor about a lump in your rectum because that's not their remit. Then there are stem cells that can become any cell type. The earliest with the most potential that turn into your cell types are stem cells from the embryo. Now what we've realized in the last few decades is that unlike the brain surgeon who will never look at a rectum again, these specialized cells can become unspecialized either through specific cellular signals for us to intentionally unspecialize them, then turn it into something like an entire kidney, which is happening in research by the way, or through mutations like in cancer. That is how a male testicular cell can become so unspecialized or undifferentiated that it starts spitting out female pregnancy hormone. We call that a germ cell tumor, and boy would that be spicy. Alright, paraneoplastic hypothyroidism due to germ cell tumor has to be my second diagnostic guess. In all fairness to our patient here, he does have a point. Alcohol is the most destructive substance consumed and it's legal. Globally, 600,000 people die each year from illicit drug use, and there were 2.6 million per year attributed to alcohol. If it were discovered today, it most definitely wouldn't be legal. That being said, tobacco kills around 8 million people a year, and that would probably still be legal in a similar way that fast food is, probably because it isn't psychoactive or linked to violent crimes. Do you think alcohol and cigarettes would be legal if they were discovered today? Let us know in the comments. Either way, we need more clues.
I hit bone. His old back injury must have flattened out his discs. I'm in.
Look at his heart rate.
It's normal.
You were supposed to tell her that we're straight.
She didn't believe me either. Now, I'm honestly trying to hit that. Nora and I spend the next few weeks hanging out, become best girlfriends. We get drunk, back rub turns into a front rub. And next morning, I've never felt this way about a woman before.
I saw her first.
You're invoking the guy code?
It's not an infection, but it might be an autonomic nerve disorder. Stuck a needle into his spinal bodies twice. His heart rate stayed normal.
You're a wuss. You're gonna beat me up? It sounds stressful. Maybe you should pop one of your beta blockers first.
It's an effect from operating outside of the law. Don't say anything to Eddie.
We stuck you in here and you went into beta blocker withdrawal. That's what caused the hypertension.
He's been in this game for a while. Either he grew a conscience over the last few months, or he's producing excess adrenaline.
Pheochromocytoma. MRI is adrenal glands.
Hello?
Hi, James. We've got some Kung Pao left.
I think I might have a little kung pao.
Did House just say pheochromocytoma? Oh, it just rolls off the tongue so beautifully. I shouldn't get too happy though, because if my 121 episodes of House in the Bag have taught me anything, it's that early diagnosis tends to be wrong. So based on my diagnostic guesses, adrenals are out and testicles are in. But speaking of balls, it seems to be our drug dealer may not be packing as much as we expected with the use of his beta blockers. But what even are they? Well, they help to calm down your nervous system stimulation by shifting the balance more towards something called parasympathetic stimulation. They work so well that in some sports they're even classed as performance enhancing drugs. This is especially true in precision sports like archery, shooting, or golf, where athletes are trained to tightly control their heart rate and breathing to limit the micro movements that might affect their shot. It would make sense that this is caused by his tumor, as someone with a more neurotic, worrisome personality is likely to choose an alternative career path to a street pharmacist. But without the high blood pressure, we're left with noise-induced vertigo, fever, and stress. In all fairness, that does still fit with a thyroid issue, and I've just realized the episode title is called The Down Low, which would match my scrotal theory just too perfectly. My next step here would definitely be to ask him if he's got any lumps, check his thyroid levels, and get him to pee on a pregnancy stick, just in case he wasn't worried about his image enough already. We could also do a blood test, but that wouldn't be quite as dramatic, would it? So let's see what happens.
I'm not gonna beg to be underpaid. I'm leaving when this case is over.
This whole thing is an act designed to earn your trust in order to sleep with you.
You're jealous. If you want to spend more time with Greg, you should just tell him.
MRI revealed no sign of a pheochromocytoma.
If you screw the antennae into the wrong sockets, it doesn't actually work. It's supposed to search for an open frequency.
There's gotta be at least one open frequency. Why the beta blockers? Beta blockers just control the symptoms of stress. That's why some people take them when they perform. This is my bug. This is yours. This guy is a cop.
I don't see how this is relevant. I get it. These guys are lowlifes. You want them off the street.
They're not just lowlifes. He's one of the biggest cocaine importers in the entire state, and the cops are gonna bust it. But if you guys get caught poking around there, the whole thing gets called off.
A drug dealer passes out without being shot, bugged his own room, and now is actually a cop. This episode has more twists and turns than a worm wrapped around an anaconda stuck in a tire while traversing a roundabout on our ever-rotating planet. Now I feel dizzy. So if this isn't from his adrenals and his environment is off limits, surely they need to come up with a creative way to crack in there undetected. That means they would be able to find something there that might give away the cause, which means environmental is most likely. Well, if they're big timers, maybe this guy actually has gotten into Breaking Bad kind of drug manufacturing equipment and exposed himself to benzene. It could potentially cause all of his symptoms, including the fever and vertigo, but then why would he get worse after leaving that environment? Well, House blamed that on beta blocker withdrawal, but that isn't the type of medicine that you get withdrawal from. The treatment for benzene poisoning would be to limit the exposure and allow it to dissipate naturally, and yet he keeps getting worse even though he would be unexposed from the toxin. Doesn't feel like the Eureka diagnosis, running out of the bath naked kind of moment to me, so let's get more clues.
I've been undercover for 16 months. I will not let it fail.
He had a GI infarction caused by a clot in his superior mesenteric artery.
And the morons still won't talk.
Guy's a hero.
Well, I'm sure the dealers who take their places will be very grateful.
So we're stuck with environmental.
Toxins, parasites, allergen.
Treat for all.
Got a better idea?
Sort of. Anybody else in that crew got sick, I'm guessing they'd be a little more self-serving. Mickey got sick because he had the most exposure. Other guys are at risk too.
I feel dizzy. I feel drugged. Trust me, I know the difference.
He'll be fine in an hour.
Do you think Mickey could die? I'll take you.
Couldn't have given us a heads up that he was living in a dry cleaner. It's like living in a vat of poison.
Did you call the cops?
Come here. I said no kissing. Look, the deal was just for you. This guy wants to watch. It's an extra 50.
Nice.
All silence and resentment. I don't know if I can go back there tonight.
Come stay at my place. It'd be fun. You know, like a sleepover.
House is seducing women while pretending to be gay. 13 is pretending to be a prostitute, and all while Foreman has been lured into quitting his job because the team made him believe he was underpaid when he isn't. If there's any more deceptions in this episode, then it'll need its own WikiLeaks page. Sounds like our patient's bowels had a leak of their own just now as a clot decided to lodge itself in the blood supply to his gut, causing the team to need to take out an entire foot of it. Considering our small intestines are actually 15 to 20 feet long, if you stretch them all out, that doesn't sound like much, but in reality, it can cause a huge problem. Well, why is that? Different parts of the bowel are important for different things. The small bowel, for example, is split into the duodenum, where the majority of iron is absorbed, the jejunum, where the majority of folic acid is absorbed, and the end called the ileum, where the majority of B12 is absorbed. Thankfully, we have ways to deal with the lack of bowel in these segments, like supplements and the body adapting so that we can in fact do pretty well with only about 6 feet of small intestine left. Shorter than that, and we may need to consider a transplant. Now we've established that our patient's incinerated intestines aren't our priority. What else could this be? Well, the team still feel this is environmental and not infectious, but then also stated there could be parasites in the environment, which last time I checked were an infection, but I'll give them a pass on that. Definitely still good. Oh, I have a theory. The underground stash houses don't just harbor undercover cops, rats also tend to make an appearance. Since drug dealers have hygiene as a top priority, they laid out rat poison which accidentally got into our patient's food, which he then ingested. This has been treating an infection in his heart, keeping his blood thin while he's exposed, but now he's out of there, the blood thinning is stopped, and microclots keep getting sent off to different parts of his body. This includes the brain and the bowel, while also explaining his fever. Oh, that would be a spicy combination. All right, infective endocarditis with rat poison toxicity has to be my third and final diagnostic guess. We are locked in. Also, what is House doing with his sleepover business? Even he isn't up to this much deception.
House, I love this man. Gregory House, will you marry me?
You two have some talking to do.
Albuterol's not helping. Patient started coughing blood.
We assumed this place was using perchloroethylene. Turns out petroleum solvents.
We've got nothing.
The VQ scan last night showed a pulmonary aneurysm. Did an embolization, stopped the bleeding. 3 more aneurysms.
If that was a fungus, he'd have 30 aneurysms.
We need to start him on antifungal meds before he drowns in his own blood.
Do it.
You could have got your brains blown out.
You're my friend. You do it for me. I should get going. Got the big man from Philly coming in tonight.
It was all our fault.
I'm not giving Foreman a raise because the 3 of you decided to amuse yourself.
We want you to take it out of our paychecks.
And just so you know, I haven't seen Foreman in 3 days.
The phrase, who's your daddy, comes to mind.
You were only spending time with me to screw with him?
I'm spending time with you because I want to touch your boobs. Wait, Wilson, he's a really good guy.
You know, maybe I will call him.
Wilson's a jerk, too. He looks like a Boy Scout, but
Epiphany moment, and it's all to do with the Boy Scout looks. Okay, wait, what if our cop's actually a lot older than he seems? He could have something called congenital adrenal hyperplasia. It's a condition that leads to overgrowth of the adrenal glands, which could potentially delay puberty and make someone look younger while also hiding an adrenal tumor. That could explain why it wasn't picked up on the scan, and that could possibly explain the aneurysms in his lungs. In all fairness though, hypothyroidism could also cause weight loss and a more youthful appearance in theory as well. Definitely a few ways this could go down in a very interesting way. I have to say, House is going about this wingmanning business in the most convoluted way possible. So funny. Also love that Foreman actually managed to double bluff the team in this magical swinging game of Sherlock Texas Hold'em they're all playing. That actually reminds me of the poker episode they did. Oh, that has to be in the top 5. All right, let's see if I'm anywhere near the right lines.
the aneurysms look mycotic, but they're not. It's Hugh Stovin.
It's an autoimmune disease. Once it's this advanced, there's not much we can do. One of them will rupture.
Even if you had told us everything we wanted to know, it wouldn't have made a difference.
I think I should call my wife now.
He died a hero in his own mind.
Hugh Stovin! Oh, I had absolutely zero chance of getting that. I've not even heard of it before. No wonder, because with the help of Professor Google, it turns out there have only ever been 30 cases ever described. Even for House, that is the rare of the rare. Autoimmune aneurysms that keep multiplying until one bursts. I wonder how that caused the vertigo though in the presence of a normal head scan. Surely they would have seen it if they managed to catch the ones in the lungs. Maybe because he did an angiogram on the lungs and that's why they found it, but not with the brain. It's plausible in all fairness, although very unlikely. Really deep niche stuff from the creators. I'm impressed. Great episode overall. I'd say 8 out of 10 entertainment, 7 out of 10 accuracy, 7.5 out of 10 diagnosis. This episode doesn't make full sense to me. Watch the previous one where Wilson gets a bit too friendly with the patient. Here